The doctor asked me how my mood was, what were my levels, and I said that I had mood swings. Now, I meant that I can go from 0 to bitchy in 5 seconds, but he heard mood swings and diagnosed me with bipolar disorder. And I didn't have bipolar disorder. So come inside, sit down, and let's discuss the different types of depressions and medications.
You have tuned into Breaking the Mask of Depression with your host, Diva with Depression.
Hey guys, welcome to Breaking the Mask of Depression with me, your host, the Diva with Depression. How are you guys doing? I hope everyone is doing well. I hope you guys are taking care of yourselves, maintaining a little bit of peace, um, maintaining a little bit of sanity. I know that it's hard because there's so much going on in the world, and so many of us are struggling emotionally, physically, financially, mentally. So we just have to do what we have to do to try to maintain. I'm not even going to say push through and it's going to be okay because, I don't want to blow smoke up your ass. But I do want you guys to try your best to maintain. I hope that you guys are doing well mentally. I feel like shit, but that's my life. This has been going on for a while, and I don't see a break coming anytime soon. So, you know, y'all just y'all just pray for me, okay? So this afternoon, I had the pleasure of being interviewed by a wonderful woman in France, ooh la la, and I will tell you guys when the episode comes out because she has a wonderful podcast. And the conversation got on to the different types of mental illnesses and how so many don't know that there are different types of mental illnesses. So people just generalize and say depression, but there are different forms of depression. People generalize and say bipolar disorder, but there's bipolar disorder 1 and 2 and schizophrenia, schizoaffective disorder. And so I decided that I was going to chat with you guys today and sort of give you a, a what is it, a beginning discussion because I really do want to do this in different parts. I have treatment resistant depression, severe depression, major depressive disorder. That who knows what the hell I have. I just know that ain't nothing getting better. But it's depression, and I've struggled with depression in different forms, different levels throughout the years. And so since that's what I have, I decided that that was the first thing that I wanted to discuss with you guys. And I'm also going to discuss the different types of mental health medications. I will, you know, I may throw some names out there, but everything that I mentioned today, if I experienced it, then I'm going to share it with you guys. I am not a doctor. Y'all remember that. No ABCs behind my name. If you are not feeling well, please, please, please call your doctor or go to urgent care. Go to a behavioral health hospital, but don't don't take me as the, the mental health Bible, okay? Because I don't know what the hell I'm doing. so, so of course, guess what? You guessed it. I have Google Facts, and that's probably what I'm going to use today. I have a bunch of different Google Facts and scribbles in my book, so if you hear me turning the page, that's because I'm reading my scribbles. But let's start with depression and the different forms of depression. And so I told you guys that I have MDD, which is Major Depressive Disorder or clinical depression. And so there are levels to it, and MDD clinical depression is one of the um, what how would I say it? One of the more intense forms of depression. It's not low grade, so those feelings that come along with that are worthlessness, suicidal thoughts, sadness, and then you'll notice that, you may have changes in your weight and that it could be gain or lose because I know personally there are days when if I can grab a cracker, I'm good. I drink water all day, but as far as eating is concerned, when I'm really, really down, I don't eat. So you can lose weight that way, or the other extreme is that if I have junk in the house, then it's easier for me to reach for a donut or a cookie and go with that. So your weight can go up or down. So don't base it on your weight and you're sleeping. Now listen, y'all. Y'all know that I don't sleep. Insomnia is a bitch. I mean, it's like Satan, okay? And my insomnia is very, very bad. And it's been like that for a while. I was never the greatest sleeper, but it's awful. And then sidebar, once you get to a certain age and you get into menopause, then who the fuck knows what sleep is because so of course menopause and then depression and PTSD and all those things, so and has me like up all night. I can get into bed at 11:30 and not go to sleep until 6 in the morning. So that is another form or symptom of depression. And that's not just MDD, that's all mental illnesses. The sleep patterns are thrown off. And you could be napping during the day, feeling fatigue all of the time. It's hard to do anything because you're so tired, but you can't sleep. And I don't know about y'all, but I get really, really nasty. Well, nastier because I get so angry and I start crying because I just want some sleep. Just a couple of hours, And so, not sleeping is a major symptom, and that's something that you should look into and share that with your doctor right away. Not sleeping or sleeping too much because, when you're sleeping, you're not feeling anything. That's the way we think about it when you have a mental illness, so the sleep patterns are off. Concentration. Now, concentration sucks across the board. That's across every mental illness. However, there are other reasons why. Let's add menopause again. You know what? Women are screwed from the rooter to the tutor from birth to death. It's not even funny. But, lack of concentration could be anxiety, it could be ADD, ADHD, and of course, adult ADHD. It could be depression. It could be bipolar disorder. From everybody that I've talked to and all that I've read, that is another symptom that is across the board. But it's of concern because if one of my issues is that I can't read a book, I can't read a magazine, I can't read like a whole article because I can't focus. It's sometimes when I'm writing these episodes or, writing a story or a blog or something, like I have to do it in parts because of my concentration is so bad. And so that's another thing that's very concerning when you're dealing with a mental illness. So please, if these are symptoms that are really plaguing you, talk to the doctor. Then there's persistent depressive disorder, which is like a low grade type of depression. The symptoms are not as intense, but it's also called dysthymia. And so, you really have to pay attention to the symptoms, but they won't take you out like some of the symptoms with MDD. So it's just a low grade type of depression. And, some people that have PDD, dysthymia, can feel better by taking a vitamin. There are vitamins out there that help with mental illness. They change their diet or they just do talk therapy, and that helps with, what they're going through. So it's not as intense, and it's something that can be maybe managed a little bit better than a more intense mental illness. The next one is bipolar depression, like I said. Um, you have depressive episodes in inside of the bipolar disorder. And another episode I will get into bipolar disorder 1 and 2 and how it's so easy to be misdiagnosed, because I was diagnosed with bipolar disorder and taking medication for it for a couple of months, and I don't have bipolar disorder. The doctor heard one word and went with it instead of listening and researching and understanding what I was really going through. So we're going to talk about that on another episode, but just letting you know that bipolar depression is a thing. Psychotic depression is you're starting to lose, lose grip with reality. Now, listen, I lose grip with reality every now and then, but I'm being serious though. You start to sort of drift, like your thoughts don't make sense. Your habits don't make sense. I don't want to say conspiracy theories, but it could be, that could be one form. You start having these wild conspiracy theories or paranoia. So that's psychotic depression. Seasonal affective disorder, SAD. You guys know I've done several episodes and blogs and pieces on that. That's with the change of seasons. That happens with the change of seasons. And so we used to think that it was from summer to spring. No, when we change from summer to winter, when it gets dark earlier. And most people, that's when it started to switch on. Like my sister, and when we go from summer to fall and winter, it hits her really, really bad. Me, it's not the summer so much, but when we go from fall to about March, it can get kind of tricky with me. The holidays and everything throws me off. But there are some people that like the winter, and they, from winter to spring or summer, they can have depression. So it's really when the seasons change. It depends on what season you enjoy. It depends on what season you're able to, still do your thing, do your hobbies. In the wintertime, for example, it snows, so in some places, and you can't get out and you can't socialize, you can't, do what you normally do. So sometimes that's where seasonal affective disorder comes in, the change of seasons. And remember, it does not have to just be from summer to fall or winter. So, postpartum depression. Now, that's a whole nother show, and last month was Postpartum Depression Awareness Month. I believe it was last month. And there were so many discussions, and I was really happy about that, because that's something that we don't pay attention to because women are largely ignored. And it's a sad thing, but people don't pay attention. Oh, she just had a baby, so she has the blues. Oh, she's just adjusting to being a new mom, blah, blah, blah. But postpartum depression is a major thing, and it's dangerous because it could be very extreme. You've seen where moms leave their babies somewhere or harm their babies because they're in a cycle of postpartum depression and they're not being treated for it. So it's not something to take lightly. And I have read that it starts after you have the baby, but I am pretty sure that I experienced it a little bit before I had my child and after. So with my first child, I was very excited to be a new mom. So, I threw myself into it and I didn't pay much attention to the depression part. And plus, I was on bed rest for both of my pregnancies. So I sort of wasn't paying attention to the depression part. And it wasn't as severe with my first baby as it was with my second baby. And I think part of it is because after I had my first, I experienced so many different horrible things, losing my grandpa, losing my father. So, there were those things that were in between my children. There's 7 years between my kids. Now, with my second baby, I believe that I was not only experienced postpartum depression, but perimenopause, premenopause. And so that made it very difficult, after I had her. And, thank goodness I have a great support system. So, if I wasn't feeling well, there were people there to help me. But postpartum depression is real, guys, and it is serious. So if you think that you are feeling that way, tell your OBGYN after you have the baby, because it's a thing, and they can help you pull through. I had to take medication. Of course, I've been taking medication for a long time. And so with my second child, there was no way that they could take me off my medication when I got pregnant with her, because I was in full-blown massive depression. So what they did when I got pregnant is there are certain medications that you can take while you're pregnant, certain mental illness medications that you can take while you're carrying, that will help you maintain throughout the pregnancy. And then if you do experience postpartum depression, at least you're on a regimen, before that. And so right after I had her, I was able to go back to the medication that I needed to maintain again. So talk to your OBGYN. If your OBGYN is brushing you off, then find a therapist or your primary care physician. But don't let it slide, ladies, because it's dangerous for you and your baby. And that is supposed to be one of the happiest times of your life. And we don't want anything to rob you of that. So, as with everything, talk to your doctors. Be very honest with your doctors and let them know. Even if you think that it's something that's not quite serious, it's a thing. Premenstrual dysphoric disorder. Again, here we go again, fucking everything that women go through. But these are mood shifts that come along when you're expecting your period or during your period. My oldest daughter, that's her thing. If she is grouchy at a certain time, she'll say, well, my period is coming. And so that's our running joke that she's going to kill me. But that's our running joke that every time that she's in a bad mood, it's like, oh, her period must be coming. But it's true. When you think about it, we only have like a week or so every month that we could be good. After that, it's like the cramps are coming, the exhaustion is coming, and then the mood swings come. And so it's a thing, y'all. Premenstrual dysphoric disorder. And like with everything else, it could be extreme. Now, I can tell you that and this may be TMI, so men close your ears, but since I started my period, they have been severe. I mean, to the point where the first 1 or 2 days I may be bedridden, and it interfered with, school and whatever, but they're intense. And so the depression and the mood swings can be intense also. So pay attention, ladies. It's not just, oh, the period blues or, the period pouting. It could be extreme. And that's another thing that you should pay attention to. Atypical depression. So, atypical depression is, I don't know, I don't want to say that it's not extreme because you'll have symptoms like the excessive eating, the hypersensitivity, sleeping again, like I said, across the board. So, atypical depression, I don't know, so I'm not going to tell you, I don't know how atypical depression is treated or recognized. So, that's something that you should talk to, of course, read up or Google it, but, you just want to be well versed in what you have going on, what your symptoms mean, and write it down. I know that I keep notes in my phone on top of all the fucking post-it notes all around my living room, bedroom, and everything. But in my phone, everybody has the notes app, some type of notes app in your phone, but keep track of it. If you have something that you think is kind of off, write it down, and see when you have an appointment with the doctor, or if you're feeling really bad and you go to the doctor, discuss it with them. So the next thing that I'm going to share, and I always share this, is the difference between a psychiatrist and a psychologist. And if you go back, I have an episode called Find Me a Care Team, where I discuss psychologists, psychiatrists, and the different ways that you can find both, and the differences. But I'm just going to quickly go over it again. A psychiatrist can provide medication. you know, they have a 4-year residency like most doctors, and they usually, after your primary care doctor, a psychiatrist is the one that will pinpoint what your symptoms mean and give you a diagnosis. So that's your when you're living with depression, the psychiatrist is just as important as your psychologist. And like I said, they can prescribe medication. And they can also, if you have to go inpatient, which I'll discuss in a minute, but if you have to go inpatient, a doctor is already affiliated with different hospitals, so they will have, I forgot the name, that the word that it is, but since they're connected to that hospital, they will be able to treat you while you're inpatient. A psychologist is also like a healthcare. I mean, they have a bachelor's degree and PhDs and different things like that, and their main duty is support, talk therapy, EMDR, trauma, different things like that. That's what a psychologist will deal with. And there are different types of psychologists, or I should say that there are psychologists that major in different things. And so I had one psychologist who was zeroed in on animal therapy. She worked with horses, and so people that had severe mental illness, that was her therapy. EMDR. My therapist is well versed in EMDR, so that's how I learned and experienced it. I experienced it for a short period of time because it was very intense. But that's her thing, one of her things. So you once you find a psychologist, you will sort of start to understand what their specialty is. And some of them will, are listed up front. Finding either doctor, a psychologist or a psychiatrist, is so hard, guys. I'm not even going to lie to you, especially now. Waiting lists are very long because so many people are struggling and there are not enough doctors to take care of everybody. And, of course, after COVID, we did lose a lot of medical um, workers. So it's really like the system is struggling. I talk to people every day and, oh, I'm on a waiting list for 6 months. Oh, so, and another good thing about a psychologist is that psychologists can also run support groups. And so you don't have to be a psychologist to run a support group, but I know that there are some psychologists that have support groups. So if you can't find or you're on a waiting list for a psychologist, maybe go online and find a support group, and then, at least you're talking. But talk therapy is one of the biggest forms of therapy. So, and that's, like I said, if you have low grade depression, it doesn't matter about the intensity. If you need to talk to somebody, go talk to a psychologist, participate in talk therapy. And in some cases, talk therapy is all you need. You don't need medication. You don't need different treatments. Talking it out with a professional helps you, and that's all you need to start to feel better. So never discount your symptoms, never discount your feelings. If you need to talk to a professional, then do that, because listen, our friends and our family, they not licensed. They're not therapists. So, find a professional. And of course, a psychologist can't prescribe medication. So, but a psychologist and a psychiatrist, they are supposed to be a team. Supposed to be. So, my therapist and my psychiatrist, they are, they do, talk to each other. It's not an everyday thing, but if my therapist starts to see that I'm slipping, which is why they had a conference last month, but then, they will start to talk to each other. If the psychiatrist sees that a medication is not working because of my depression tanking, then she will contact my psychologist to find out, how things are going. So they are supposed to be a team, and you want to make sure that they are a team. You want to make sure that they communicate, because they have to work together to make you feel better. Not necessarily your primary care doctor, but I've been fortunate that I do have primary care doctors that are pretty well versed in mental illness. So, when I go with a symptom, when I'm getting my physical or I go for a sick visit, then she can tell me if that is my depression worsening or my anxiety acting up and different things like that. So, but the psychologist and the psychiatrist should be working together to help you get better. And there are different types of therapy. There's behavioral therapy, brain-based, which I just told you about, EMDR, brain spotting. Mindfulness and meditation are big now. You hear about mindfulness everywhere nowadays. So that's a big thing. And listen, I'm not discounting it, because there are so many people that are benefiting from it. So, if that's the direction that you go in, you want to sort of go the holistic route, then do that. Behavioral therapy, you guys always hear me talking about the ABCs, but there's cognitive behavioral therapy, and I think it's dialectical behavioral therapy, DBT, and CBT. And I hate them both. and it's really only because when you're inpatient, Jesus, that's all they talk about. inpatient and intensive outpatient. Every group there's a CBT discussion or a DBT discussion, so they get on my nerves. But research them because they can help. Um, I don't discount them at all. I just got tired of it. Um, every time I was inpatient or doing the intensive outpatient. Psychodynamics, psychoanalysts, those are different types of therapies. Really just seeing the problem, like what's behind the problem, what's driving those feelings, what's driving the behaviors. So, you know, that's psychodynamic, psychoanalysts. So those are, it's not an intense form of therapy in the beginning because you're just trying to find out what's driving the behaviors and your symptoms. Um, but talk therapy, again, like I said, is the main thing that a lot of people do. Inpatient, outpatient. Inpatient is when you stay in a facility. There's no specific time that you stay in the facility. I have stayed for 7 days, I believe, and 5 days. But I know people that are there for longer. And my experiences with inpatient, um, it it's not a happy place to be. It's restricted, so you can't come and go. Um, I know that there are some programs where you're allowed to go out, but my experience has been that you are in the ward for as long as you're there, and the only outside that you get is smoke breaks. And so that's why so many of us start smoking when we're inpatient, so we can go outside. Um, and you, the good thing is that you have access to doctors, quality doctors, hopefully, and nurses. And so they're right there. So if a medication is not working or your symptoms are getting worse, then there's a team there already in the hospital that can help you and refer you to different areas of the hospital. So one of my last breakdowns after my sister passed away, I had to be and go inpatient, and outside of my group therapy and my art therapy, they sent me to grief therapy on another wing of the hospital. So it's, there's a care team there to monitor you every single day, all day. And that's the good part. You know, I don't know if, I don't know what else I mean, the art part, the art therapy, music therapy, I learned a lot. I it helps that you're there with other people that are going through the same thing that you're going through, but it could be scary because you're there with people that are at another level of mental illness, so it can be extreme. But 28 days to 6 months, but 24-hour care. You do have visitation. Some of them, everyone that I've been in has had visitation, but supposedly it's a higher success rate. I don't know. Outpatient rehab is you stay home, and it's outpatient rehab or intensive outpatient, and it's full day or half day. I've done both. And you're home, but you go to treatment during the day. And the one thing is that they like that it's a routine. So I'll give you an example of a day. The day, my last outpatient experience, the van came to pick me up at 8:30, say 8:30, 8:15, 8:30, and then I get to the facility, sign in, you have some downtime. Oh, you sign up for whatever groups you want to attend that day, and then you have a few minutes of downtime to either eat your breakfast or, just woosah before your groups start. And then if you were full day, then there was lunch provided, and we had lunch, and then we went to our afternoon sessions. In some places, you get lunch whether you're full or half. And I know in my last day, there were different buildings for outpatient. So there was an outpatient section for young people. So, it could be 3 months, it could be a year. Again, you're in groups, so you're talking to people that are going through what you're going through, and you're able to bounce. I guess that's the word, bounce your life off of their life. I have met some amazing people in group therapy in the outpatient facilities. There were doctors, lawyers, authors, presidents of college, down to me who didn't have a job. There are people from pilot. These are the people that I met while I was there. So there's just a group of people there, and we're all there for the same thing, to try to heal, try to get better. And usually the day is, your first group will be something like the DBT, CBT, and then your second group will be your main group. So you're assigned to a psychologist, and that's the group that you go to. Then you have lunch, and then the afternoon was usually group therapy. Again, outside, and this isn't your main group. This is group therapy with a different psychologist, and then an occupational therapy. That's what they call it. I always did art therapy, but there was art therapy, pet therapy, music therapy, journaling. So that's usually your day, and it wasn't a bad experience. It wasn't as bad as the inpatient. So it could be 10 to 12 hours a week. Yeah, and so if you hear the doctor say to go to intensive outpatient therapy or outpatient program, that may be better than going inpatient. I have, when I was outpatient, my last breakdown, I went from inpatient to outpatient, and then my breakdown was getting worse, so that I had to go back to inpatient and then back to outpatient. So it's up in the air. My first breakdown, I did inpatient for a couple of days, but I did intensive outpatient after I got out of the hospital. So it could be different things. So then there's medications. There's SNRIs, there are SSRIs, and there's NDRIs. And so NDRIs increase your dopamine neurotransmitters, and there's different ones. There's paroxetine, fluvoxamine, and these are, I always say that they're like the generic names for the name brands. SSRIs stands for selective serotonin reuptake inhibitors. NDRI stands for norepinephrine and dopamine reuptake inhibitors. So NDRIs work with the dopamine, and SSRIs work with the serotonin in your brain, and those are more geared towards like the major depressive disorder sometimes. So like Wellbutrin is a well-known SSRI. And it's used to treat, SSRIs are usually used to treat anxiety, panic, PTSD, social phobia. NDRIs are used to treat SAD, bipolar depression, ADD, hyperactivity, and they even help with smoking. Small tip, Wellbutrin helps with not quitting smoking. I learned that one day an EMT told me that that's why he takes it, because that's why he was taking it, because he was trying to stop smoking. So SSRI, serotonin, and then you have the SNRI, which is an antidepressant medicine that works, again, it's like the NDRI. And so the SSRI, again, some of the more common ones are, Wellbutrin, and let's see, there's a list. Well, SSRI, Zoloft, Prozac. Prozac is one of the major ones. SNRI, the SNRI works for pain and depression, so it could be Effexor or Cymbalta. MAOI is another form, and that's, I don't know anything about that. I'm just telling you what I see. Tricyclic could be Elavil, and sometimes you get, that's all medications actually. You see that all of these commercials now for tardive dyskinesia, where you shake. So a lot of these medications cause that. Atypical is the Wellbutrin and the Remeron, and those are also used to treat SAD and anxiety. And I will tell you that depending on what you are living with, you will be taking multiple at one time sometimes. So I take an SSRI, I take an SNRI, and I take an atypical NDRI. So, depending on your symptoms or how the doctor goes about treating it, then, that's how you will be treated. And this is up to the psychiatrist. Again, the psychiatrist will monitor your medication. You will talk to them about the side effects that you have. And listen, I'm not even going to lie to you guys. There are a million. Insomnia, dry mouth, headaches, sweating, appetite changes, nausea, blurred vision. Oh my gosh. You don't even understand that and that's why I say, even if you think it's minor, it's major, because you can't see shit. So the SSRIs are, they call it the drowsiness and the headaches. The Tricyclics, dry mouth, headaches, drowsiness. So, every medication has their own side effects, and then there are side effects that are across the board, like the dry mouth and the headaches and the nausea. Those are pretty common across the board. And SSRI, I will give you some examples. Lexapro, Luvox, Zoloft, Paxil, Celexa, those are the common ones. SNRIs, the common ones are Cymbalta and Effexor. And the MAOIs, those aren't anything that I've experienced, but Marplan, Nardil. And then there are some other combinations. Again, the Wellbutrin, the Remeron. I will tell you that Wellbutrin, the smoking, it helps with the smoking, and it also helps with appetite suppressant. Remeron, I had to stop taking it because I was eating 24 hours a day. So that, that's a major side effect. Cymbalta is another one. The dizziness and the blood pressure, that was major when I was taking the Cymbalta. So I had to take my blood pressure every single day. And then, Lexapro, Zoloft. Zoloft is something that I'm taking right now, and the drowsiness is a big thing, and the sweating. In women, you have menopause, so you're sweating 24 hours a goddamn day. It's crazy. It's crazy. And guys, one of the, people joke about it, but it's not a joke. But there are sexual side effects across the board, and a lot of these medications suppress your sexual appetite. So I know that that can become a problem, if you're in a relationship, because especially if your partner doesn't understand that that's why your libido is low. So I know that there are new medications out there that don't have that effect. So that's a good thing, because that is something that is major. So guys, that is my Google Mania for the day. I hope that this was helpful for you guys. I want you to be informed, because if we're not well informed, then they can tell us anything. And you have to be your biggest advocate, because the medical profession, there are some that just don't give a fuck about you. So you have to fight for you and make sure that you are being treated well, that you are getting the right treatment, and that you are healing and getting better. So these conversations are very important, because now you're equipped going in. So listen to this as many times as you want to or have to. Share it with people that need it, or people that you want to be more informed. These resources are on my website also, divawithdepression.com. There's a lot of information on there. I am going to, of course, as usual, I'll place the blog on and the link to this episode on my website, and there you will have access to the information that I just discussed. Again, I am not a doctor, so please don't go off of my experiences. Go get help if you need help. That information is on my website, divawithdepression.com. I also have it on my Instagram page. In the highlight section, I have the different numbers that you can call if you're not feeling well. But please, 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 if you are not feeling well mentally, go get help. Urgent care. Now the urgent care centers are more well versed in mental illness, so that helps. If you have to go to the emergency room, then do that, but don't put yourself in danger, and don't put anybody else in danger. Guys, stay well, find a little peace, find a little joy, find a donut if that helps, but try to maintain your sanity, your peace, and take care of yourself. And I will talk to you guys later. Bye.
Sometimes realize that